Are you a woman over 50 who wants to feel stronger, healthier, and more confident every single day? Imagine if your best years of health and happiness are still ahead of you. You're in the right place. Stay with me to discover how you can make the most of this exciting new chapter. Welcome. Today we're going to explore an important topic for women's health: what happens to your body after menopause, and how you can recognize and manage the changes. Postmenopause begins when you haven't had a period for 12 consecutive months. This phase brings a significant drop in estrogen and other hormones, which can affect many parts of your body. Understanding these changes is the first step to protecting your health and well-being in the years ahead. 1. Persistent hot flashes and night sweats. Let's start with hot flashes and night sweats. Many women believe these symptoms end with menopause, but for some they can continue for years afterward. Hot flashes are sudden feelings of intense heat, often starting in the face or chest, and may be accompanied by sweating, flushing, a rapid heartbeat, and even anxiety. Night sweats are similar, but occur during sleep, often waking you up drenched and uncomfortable. These symptoms can seriously disrupt your sleep and daily life. Chronic sleep loss can lead to fatigue, irritability, and trouble concentrating, and may even contribute to mood disorders and a weakened immune system. What can you do? First, try to keep your environment cool. Use fans, air conditioning, and light, breathable clothing. Identify and avoid triggers like spicy foods, caffeine, alcohol, and hot drinks. Relaxation techniques such as deep breathing, meditation, or yoga can help manage stress, which often makes symptoms worse. If hot flashes are severe or interfere with your quality of life, talk to your doctor. Hormone replacement therapy is the most effective treatment for many women, but it's not suitable for everyone. There are also non-hormonal medications, such as certain antidepressants, gabapentin, or clonidine, that may help. Some women explore alternative therapies, but always discuss these with your healthcare provider to ensure safety. 2. Vaginal dryness and discomfort. Another common issue after menopause is vaginal dryness and discomfort. As estrogen levels fall, the tissues of the vagina become thinner, drier, and less elastic, a condition known as vaginal atrophy or genitourinary syndrome of menopause. This can cause itching, burning, and pain during intercourse, and may even lead to light bleeding after sex. The risk of vaginal and urinary tract infections also increases. These symptoms can have a big impact on your intimate relationships and self-confidence, but there are effective solutions. Regular use of vaginal moisturizers can help keep tissues hydrated, while water-based lubricants can make intimacy more comfortable. If over-the-counter products aren't enough, local estrogen therapy, applied directly to the vagina as a cream, tablet, or ring, is very effective and generally safe for most women. Non-hormonal options, like ospemifene or DHEA vaginal inserts, are also available for those who can't use estrogen. Pelvic floor exercises help maintain vaginal tone and urinary control, and regular sexual activity, if possible, helps keep tissues healthy. Always consult your doctor if you have persistent symptoms, pain, or recurrent infections, as these could signal other conditions that need attention. 3. Urinary changes and increased infections. Postmenopause can bring changes to your urinary system as well. The same hormonal shifts that affect the vagina also impact the bladder and urethra, making their linings thinner and less elastic. You might notice you need to urinate more often, feel a sudden urge to go, or even experience leakage when you laugh, sneeze, or exercise. The risk of urinary tract infections also rises. These issues can affect your confidence, social life, and willingness to be active. To help, practice pelvic floor exercises, also known as Kegels, to strengthen the muscles that support your bladder and urethra. Maintaining a healthy weight reduces pressure on your bladder. Bladder training, gradually increasing the time between bathroom visits, can also help. Make sure to drink enough fluids to keep your urine from becoming too concentrated, which can irritate the bladder. Avoid bladder irritants like caffeine, alcohol, and artificial sweeteners. Good hygiene is essential. Always wipe from front to back, urinate after intercourse, and avoid harsh soaps or douches. If you have frequent infections or trouble with incontinence, see your doctor. Local estrogen therapy may also help improve urinary symptoms and reduce infections. 4. Bone loss and increased fracture risk. Bone health is a major concern after menopause. Estrogen helps keep bones strong, so when levels drop, bone loss accelerates. This increases your risk of osteoporosis, a condition where bones become weak and brittle, and fractures, especially in the hip, spine, and wrist. Osteoporosis is often called a silent disease because you might not notice any symptoms until a bone breaks. Protecting your bones starts with nutrition. Make sure you're getting enough calcium, about 1,200 milligrams a day for women over 50, and vitamin D, which helps your body absorb calcium. Weight-bearing exercises like walking, jogging, dancing, and resistance training with weights or bands are essential for building and maintaining bone strength. Avoid smoking and limit alcohol, as both can accelerate bone loss. Your doctor may recommend a bone density scan, especially if you're over 65 or have risk factors like a family history of osteoporosis, previous fractures, or certain medications. If you're at high risk or already have osteoporosis, medications such as bisphosphonates, denosumab, or raloxifene may be prescribed to help strengthen your bones. Preventing falls is also crucial. Remove tripping hazards at home, use nightlights, and consider balance training or physical therapy if you feel unsteady. 5. Elevated cardiovascular risk. Finally, let's talk about heart health. After menopause, your risk of heart disease rises significantly. Estrogen helps keep blood vessels flexible and cholesterol levels in check, so when it declines, you may see increases in blood pressure, LDL or bad cholesterol, and blood sugar. Heart disease is now the leading cause of death in postmenopausal women, yet its symptoms can be subtle: fatigue, shortness of breath, or indigestion, rather than the classic chest pain. To protect your heart, have your blood pressure, cholesterol, and blood sugar checked regularly. Eat a heart-healthy diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like those found in the Mediterranean diet. Exercise regularly. Aim for at least 150 minutes of moderate activity each week. Maintain a healthy weight, don't smoke, and limit alcohol. If you have other conditions like diabetes or high blood pressure, work with your doctor to keep them under control. Knowing your family history and sharing it with your healthcare provider is also important for assessing your risk. When to seek medical advice. It's important to know when to reach out for help. Any vaginal bleeding after menopause is not normal and should be checked by your doctor right away, as it could indicate a serious condition. Persistent or severe symptoms, such as hot flashes, sleep problems, pain, or urinary issues that disrupt your daily life, also warrant medical attention. Be alert for signs of infection, like burning with urination, fever, or pelvic pain, and seek immediate care for sudden health changes, such as chest pain, difficulty breathing, or unexplained weight loss. Lifestyle strategies and treatment options. Engage in regular weight-bearing and resistance exercises, such as walking, dancing, or lifting weights, to strengthen bones and muscles and help prevent osteoporosis. Incorporate heart-healthy aerobic activities like swimming, cycling, or brisk walking to support cardiovascular health and maintain a healthy weight. Eat a balanced diet rich in calcium and vitamin D to support bone health. Include dairy products, leafy greens, fortified foods, and safe sun exposure for vitamin D. Focus on a diet high in fruits, vegetables, whole grains, lean proteins, and healthy fats, such as olive oil and nuts, to reduce the risk of heart disease and support overall wellness. Limit processed foods, added sugars, and saturated fats to help manage cholesterol, blood pressure, and blood sugar levels. Stay hydrated by drinking plenty of water throughout the day, which supports metabolism, skin health, and urinary tract function. Avoid smoking, as it accelerates bone loss, increases the risk of heart disease, and worsens menopausal symptoms. Limit alcohol consumption, as excessive drinking can weaken bones, raise blood pressure, and increase the risk of certain cancers. Practice stress management techniques, such as yoga, meditation, deep breathing exercises, or mindfulness, to improve mood and sleep quality. Prioritize sleep by establishing a consistent bedtime routine, keeping your bedroom cool and dark, and avoiding screens and caffeine before bed. Maintain a healthy weight, as excess weight increases the risk of heart disease, diabetes, and joint problems. Consider pelvic floor exercises, Kegels to strengthen the muscles that support the bladder and vagina, reducing the risk of urinary incontinence. Schedule regular checkups with your healthcare provider to monitor blood pressure, cholesterol, blood sugar, and bone density, and to discuss any new symptoms or concerns. Review all medications and supplements with your doctor, as some can interact or worsen postmenopausal symptoms or increase health risks. Seek support for your mental and emotional well-being. Counseling, therapy, or support groups can help you manage mood changes, anxiety, or depression. Discuss hormone replacement therapy, HRT, with your healthcare provider if you have bothersome hot flashes or other menopausal symptoms, and review the risks and benefits based on your personal health history. Explore non-hormonal treatment options for symptoms such as hot flashes, vaginal dryness, or sleep disturbances, including certain antidepressants, local estrogen therapies, or over-the-counter moisturizers and lubricants. Practice good skin care, as declining estrogen can lead to dryness and thinning. Use gentle cleansers and moisturizers and protect your skin from sun damage. Stay socially active and nurture relationships with friends and family, as social connection supports mental and emotional health. Stay informed about your health by reading reputable sources and asking your healthcare provider questions about any changes you notice after menopause. Remember, every woman's experience with menopause is unique. Work closely with your healthcare provider to develop a personalized plan that addresses your specific needs, preferences, and risk factors, ensuring you enjoy a healthy and fulfilling life after menopause. Postmenopause is a natural stage of life, but it brings unique health challenges. By understanding the signs and taking proactive steps through lifestyle changes, regular checkups, and medical support when needed, you can maintain your health, independence, and quality of life for many years to come. Don't hesitate to reach out to your healthcare provider with any concerns, and remember, you have the power to take charge of your health and well-being in this new chapter of life. If you found these insights helpful, don't forget to subscribe and join our supportive community of strong, inspiring women. Hit the bell icon so you never miss an update, packed with expert advice just for you. Share your thoughts or questions in the comments. We love hearing your stories. Together, let's make every year healthier and happier on Senior Woman Health Plus.